We have a very special patient who's traveled to come see us with plan for surgery. Our patient has done an amazing job of losing massive weight. He's actually lost close to 150 pounds, which has resulted in some loosening of skin around his waistline. One of the things that bothers him is the appearance of the chest with the hanging tissue and also the excess tissue that he has around his waistline extending to the back. So one of the things that we're going to be doing today is address the gynecomastia in the chest. We're going to be doing what we call the Z lift, which involves essentially doing pretty extensive liposuction here, removing the extra skin, including removing the nipple, replacing it over here. And then this, by having a Z lift, what it allows us to do, we have a lot of excess tissue back here, and we're going to be basically trying to remove this and try to basically use the gynecomastia repair to also do what we call a vertical back lift. Now, at the same time, we're going to combine this with pretty extensive liposuction around the waistline, and we're planning to do a tummy tuck. For the most part, I think it's going to look amazing. There's always, with weight loss, there's always possibility that the skin may further loosen up, but nevertheless, the goal is to provide as good of a contour as you can in one single setting. So we're now at the end of the case. We've done basically treatment of gynecomastia. This was a Z lift, so it's actually a back lift as well. It goes into the back of the armpit and it includes removing the extra tissue in the axilla and the back, as well as the chest. And then these are nipple areola grafts that are going to heal really nicely. The patient also had a tummy tuck. We did some liposuction. His fat is very fibrotic, so we had a little bit difficulty getting more fat out. Normally we like to flatten this out more in somebody who's got more cooperative fat and more normal fat. But for the most part, he has very good improvement in the shape of his contour, and we're going to be sure he's going to be really happy with the results.